Hello, my name is Claire Gibson and I work as a CBT therapist. I'm here on World Suicide Prevention Day to think in a bit more detail about one of the risk factors for suicide and the ways in which we may be able to prevent it. The risk factor I'd like to reflect on is that of isolation, the feeling or sense of being cut off from others. Due to the pandemic, restrictions were placed on human contact. We were refined to one household, and face-to-face contact with other friends, family members, colleagues, and faith communities was prohibited. Lockdown has now eased, but measures still remain in place which can hinder human contact and connections. For example, masks and social distancing can make it much harder to strike up spontaneous conversation on a bus or in a shop. And also physical touch, a simple hug which can boost the feel-good hormones, now becomes a risk. And for many, their social activities and hobbies have stopped or altered in some way. And with an increase in working from home and also in job losses, many may have lost the connections that work would have brought them. And also, sadly, many may have lost a loved one, again, likely to increase a sense of loneliness and maybe isolation. So with isolation potentially on the rise, what can be done to try and tackle it, especially in the context of the pandemic? For those working in mental health services, it can be important to check and ask your clients about their connections and sense of isolation. Questions such as, do you have others you feel close to and connected with? How often do you see or speak to those people? Does that feel enough for you? Have you still been able to maintain your relationships with others during the pandemic? With more information on how isolated someone feels, we can then better think with them about what interventions might be helpful. For some of us, technology greatly helped fending off feelings of isolation and loneliness during lockdown. But for others who maybe felt they couldn't participate, it actually may have increased their sense of isolation even more, a sense of feeling left out. Those with limited incomes may not have been able to afford the technology, and for others, such as older adults or those with learning disabilities, they may not have had the skills to be able to benefit from the digital world. This doesn't have to be the case. Charities such as Connect the Love and Wavelength help to link vulnerable people with smartphones and tablets. There's many courses to help people to be able to use things such as Zoom and WhatsApp to help build their connections. We can also help clients to access activities that are still running. Most activities have been adapted in some way. A yoga class that once happened in a gym may now be in a park, or the pub quiz is on Zoom. But helping our clients to find meaningful activities that link with their values can increase their sense of connection. Of course, if people are feeling isolated, they may not reach out to mental health services. So we actually may need to reach out to them, to go into the local community, to talk to people, to ask them what do they need to feel less isolated and more connected right now. And to listen to and learn and work with those who have lived experience of feeling suicidal and isolated. What helped then? When they were feeling disconnected from others, What was that like, and what did they need? And as individuals, we can all play a part. We can give our friends, colleagues, relatives a call to find out how they're really doing and make sure we have the time to listen to their answer. We can check in on our neighbours, especially those who we know might not have as many people checking in on them. And we ourselves can also help someone we know to be able to use Zoom or WhatsApp, or give them an old smartphone. It might make the world of difference to the connection they have with others. And just ending with the reminder that not only can strong human bonds bring joy, comfort, and meaning to life, they can also be hugely protective against suicide. Thank you for listening.